Welcome back. Here we are going to see the most important and the high topic, that is the mostly tested neuro topics which are most important in the Nclex point of view. So I'm going to give a quick overview what we have to go through. So let's go into the topic. First one is a stroke. Stroke is a cerebrovascular accident. Here the very high points which we should remember is ischemic versus the hemorrhagic differences. We have to see the different types of most important changes which happens in the ischemic and the hemorrhagic type of stroke, and we have to see the thrombolytic, that is TPA safety, when the thrombolytic therapy has to be safely given in which type of stroke. It is mostly given in the ischemic type of stroke. And we have to see the next important point is the swallowing evaluation before we are going to give any oral type of fluids or oral feeds. Yeah, and the next important point is the head positioning. What head positioning has to be given? In ischemic stroke, the head of the bed should be 30 degrees elevated, and in hemorrhagic type of stroke, the head of the bed should be 30 to 45 degrees elevated. And the Nclex trap here is giving food or water before conducting the swallowing test. We should always see, and we have to note it down just to prevent the aspiration risk of the patient. The next important topic which is we are going to discuss is about the increased intracranial pressure. Here the early signs are the restlessness, headache, vomiting without nausea, and decreased loss of consciousness. And the late signs are the Cushing triad. Here in Cushing triad we are going to see the bradycardia, hypertension, that is widens pulse pressure, and the irregular respirations. The main nursing priority what we are going to see is the head of the bed should be elevated at 30 degrees, and the neutral neck position and the alignment has to be maintained, and avoid coughing or suctioning very frequently. These things has to be noted, and then we have to provide a quiet environment to the patients. And the next important topic is the meningitis. Here the classic triad is fever, neck stiffness. It is called the Kernicks-Brudzinski sign, and altered loss of consciousness. And the priority is we have to start the droplet precautions immediately, as it can spread to the other patients, and the antibiotics has to be started as soon as possible. And the Nclex trap which we encounter in this topic is we should not delay the antibiotic waiting for the CT or the lumbar puncture, even if the symptoms are very severe. So the antibiotic has to be started very early. The next important topic which has been mostly assessed